Thank you, and welcome everyone to our March Food Safety Matters webinar, the first one of 2020. We look forward to a nice series for you through the year. Today we're going to start off by talking about the essentials, things that you need to know about food safety, but we're going to go a little bit deeper. Now, we all know that poor food safety practices can obviously have a big impact, certainly on lives. People can be injured, hospitalized, or even die from foodborne illness. It can affect a restaurant's bottom line or a food company's bottom line and loss of revenue. It can certainly erode consumer trust, leading to loss of brand reputation. Today, we're going to talk about 3 top food safety concerns and what your role is in helping to manage these effectively. First, temperature control, then we'll talk about cross-contamination and personal hygiene. And we chose these because these really are top causes of foodborne illness and top reasons for violations that occur in inspections of food service settings. So let's dig into these. Temperature control. Why is temperature control so important? If we think about the science behind those temperature requirements we all need to follow, I want to talk and think about Clostridium perfringens and the fact that its spores can lead to illness occurring. The reality is that these spores from an organism like Clostridium perfringens, frankly, are very common in raw meat and poultry. But these spores need activation. That is, in the spore setting itself, it's not going to cause illness. But once they are activated, such as with heating, which we do for raw meat and poultry in a cook step, those spores will germinate or outgrow. And those result in the development of infective cells that can cause illness. We know, though, that Clostridium perfringens prefers to grow in conditions where there's, frankly, little oxygen present, and under ideal conditions can multiply very rapidly. So think in a deep pan of food towards the bottom of that pan where there's less oxygen there, and those spores that will be there from the meat, under the right conditions, such as temperatures between 109 and 117 Fahrenheit, they'll grow very rapidly. And then if that food is served without being reheated to kill those bacteria that have resulted, we may be eating the live bacteria. And then once we do that, they produce a toxin inside of our intestines that can cause illness. So here's some examples to illustrate this. A situation with taco meat resulted in illness for at least 108 people. People who had eaten this meat had symptoms of nausea, cramps, and diarrhea, and they were able to isolate both Clostridium perfringens cells and its toxin from samples from patients' feces. The median onset of illness was short, about 7 hours, and some as quick as 1 hour after eating. And what was found is that cases of people who got sick were more likely to have consumed a chicken taco meat mixture. The environmental health specialists who did the investigation of this illness found these contributing factors. First, that there were some leftovers from the original meal, which were combined and then brought to a simmer and placed in very large steel pans that were as much as 6 inches deep. These were temporarily placed on a rack in the freezer for an undisclosed period of time and then covered in plastic wrap and placed in the walk-in cooler. It's likely that they did not cool down effectively. When they tried to serve these meat, there was a malfunctioning hot holding unit, and the temperature of the meat mixture was about 90 degrees Fahrenheit. They were able to isolate the toxin from the food samples. Now, just in reading this, we can certainly see lots and lots of issues that occurred, but the reality is things like this do occur. So the other thing that had happened in this particular situation, this food service establishment had some warnings that things were going on. Previously, they had been cited for time and temperature control deficiencies, faulty equipment, failure to date mark food, etc. They also had inadequate sanitizing practices for their dishware and poor storage of utensils. So there were some red flags out there that perhaps led to this. Here's another situation, and this relates to the formation of scrambroid toxin, or histamine, from fish products. We know that if this is consumed, it can result in a variety of gastrointestinal symptoms, but also allergy-like reactions as far as puffiness, itchiness, etc. The science behind it is that histamine is produced in a fish after it dies if it's improperly cooled. And typically, warm storage of that fish allows the native bacteria that are in that fish to grow and produce this enzyme that reacts with naturally occurring amino acids in the fish and result in the formation of this toxin. So typically, the fish who are associated with this kind of poisoning have high levels of certain kinds of amino acids that allow for this to be formed. And we see issues sometimes with mahi-mahi, tuna, bluefish, marlin, etc. The challenge with this toxin is that it's not destroyed in cooking and it's undetectable to the consumer. We've seen some outbreaks related to this. One in ground tuna, where tuna meat was thawed. It had been refrozen after being formed into patties, but it went through several freeze-thaw cycles, which allowed the toxin to be produced. And the reality is that the meat that was sourced for this came from the belly portion of the fish, which is especially vulnerable to contamination. And it was believed that the grinding process where they made that ground tuna product might have resulted in raising the temperature of the meat through friction and then mixing in bacteria, again, that form the toxin in with uncontaminated material. So Mandy, I'll turn it to you to tell us what we should be doing from a proper control standpoint.
Okay, great. When we talk about proper cooling, reheating, and as well as keeping food at the proper temperature, in order for us to reduce the risks, we need to know where they are in our operations. When we go from receiving to serving, there are multiple areas along that chain where there can be breakdowns in food safety practices and increase the risk of foodborne illness. It's important to identify the risks, understand where they are, how you control them, monitor them, and take corrective action. Okay, we can move forward. Thank you. Whose responsibilities are these along the path? That's important to know whose roles and responsibilities are what. So when we look at the food code and we look at the person in charge, it clearly states that the person in charge needs to be able to explain what Ruth just spoke about, the significance and the connection of maintaining temperature control to reduce illness. Also stating the required food temperatures. The last slide just showed that there are certain thresholds at every stage along the process that are control points to make sure we are within that. That is the person in charge's responsibility. To identify those risks, again, monitor behaviors and take corrective action. Some of the best practices, specifically to what we talked about histamine, Ruth touched on that. You want to make sure that you have an approved source with proper temperature control systems. When you have any vendors coming in for key drops, they leave some of the product in overnight. It's important that you have a policy in place to know they are following the same procedures as you do. And now we're seeing ghost kitchens, and we need to understand whose guidelines and whose roles are within that kitchen. Whose responsibility is it to receive products and maintain the coolers and common spaces and temperature control. The responsibilities of employees. They need to know what to do. So they need to have that training and coaching, but beyond that, they need to follow the critical control points. So as an employee, we would limit that time out of time control, maintain cold products frozen or below 41, label everything properly, cook the food to the required temperatures, understand the risks. Again, people know the why. It's much easier to know the how. It's important to share this information with everyone on the team. We also talk about some best practices with employees, and there is a lot on this slide, and it will be available after for everybody to look through. But some main ones that we talk about are making sure that we organize storage areas before we come in, get everything away properly, work with small batches, and minimize multitasking, which can be hard, but do as often as you can. Pre-cooling or preheating equipment before placing product inside. It's important to note that when you're making something in production, it raises temperature and you want to put it under temperature control. Cold holding and hot holding units are not meant to reheat or cool. They are meant to maintain temperature. So it's very important to know, again, what Ruth spoke on with C. perfringens. If we're not reheating to the right temperatures in the proper equipment and then holding in the proper equipment and using them what they're made for, we can put others at risk with foodborne illness. All right, Ruth, if we want to move on.
Thank you, Mandy. So the second food safety best practice that we want to speak to is related to cross-contamination. Now, I think we all intuitively know what this is. Really, it's the accidental transfer of a contaminant from one surface or substance to another, usually because of improper handling practices. In a food setting, typically this refers to the transfer of contaminant from a surface, object, or person to food. And it usually refers to biological contamination, think bacteria or viruses, but it can also be a physical or a chemical kind of contaminant as well. The many routes of cross-contamination include food handlers. Now, we all know that people do carry microorganisms in our bodily fluids, in our clothing, et cetera, and we need to guard against this. Food handling techniques can also be another source of a cross-contaminant, from a cutting board or a utensil that might be used for a raw food, also being used for a cooked food or for a different type of food. Cleaning and sanitizing, if not done properly, can also be another route of cross-contamination. Also food storage, so improperly storing raw meat on shelves, say, above where a ready-to-eat food might be stored, and then having the raw meat juices drip down onto that ready-to-eat food. Finally, waste disposal. If garbage containers overflow, they may be a source of cross-contamination. And pests can also be. So what's the significance of this? Well, some recent research revealed, for example, that 40% of the time, certain cutting boards for raw meat were rarely or only partially used in the right situations. This was a survey of almost 450 restaurant managers, and it was also discovered that 1 in 3 of those managers didn't wash and rinse surfaces before sanitizing them. We know that common organisms on surfaces that originate from food primarily can be Salmonella or Listeria monocytogenes or Norovirus, which can come from people. And certainly these can lead to illness if they're not managed appropriately. We also know that common foodborne pathogens can be transferred from pests. Large flies, we know, can carry E. coli and Salmonella. Small flies, also E. coli and Salmonella and Listeria. Rodents and cockroaches can carry a variety of bacteria as well, that if they're allowed to get near food, can result in cross-contamination. What do we do about this? Well, we can manage a lot of these cross-contamination risks with proper sanitation. The CDC tells us that contamination of surfaces contributes to about 13% of all foodborne illness. And we know that unclean surfaces can harbor harmful microorganisms that can ultimately be transferred to foods. For food contact surfaces, the food code requires cleaning at least every 24 hours, assuming that temperature is being maintained. But we know that cleanliness of these surfaces is cited as much as 20% of the time by inspectors. So clearly, people are supposed to do it, but it is not done. There's also supposed to be cleanliness performed of non-food contact surfaces. For the food code, this is to be done at a frequency necessary to preclude accumulation of food soils and others. But citing inspection data again, we know that 22% of the time, this is not done properly. So what can result? In Wisconsin, there was a significant outbreak of E. coli 0157H7 that resulted in 60 illnesses and 1 death. Likely this came from uncooked beef, where they found the outbreak strain isolated from samples of raw taco meat and sirloin tri-tips. But it was discovered that there was cross-contamination of fresh fruit in the food service establishment with the raw meat products. It was also discovered that the meat handling and processing area in the restaurant was very close to where the ready-to-eat food preparation area was, resulting likely in the contamination of that fresh fruit. Campylobacter is another bacteria commonly found in poultry products that can make us ill, and often the cause is through cross-contamination. A cafeteria meal resulted in 55 people becoming ill due to Campylobacter contamination. In this situation, raw chicken was washed and cooked on the day that it was served, but inspection of the facility where this was done found that the drain pipe under the meat cleaning sink didn't work, allowing the water to escape from the drain pipe and onto the floor. And it's believed that cross-contamination likely occurred from that floor to the countertop, to the hands, and kitchen utensils. And then fresh produce were prepared on that same countertop and came in contact with some of the same cookware. So it's easy to see in retrospect how this could have happened, but it did, and it should not have.
Thank you, Ruth.
What should we be doing to help better manage cross-contamination?
All right, thank you. Again, let's look at the roles and responsibilities between the manager and the employees. Describing the relationship between the prevention of hand washing, cross-contamination, bare hand contact with ready-to-eat food, and maintaining the food establishment in a clean condition and good repair is of utmost importance. Again, the why and the role in that the manager plays is of utmost importance. It's also important to know the role that sources of water and also with chemicals that you're using in your own food service area, how they can affect those in your restaurants and those that you serve. Monitoring and taking corrective action is of utmost importance. Again, that corrective action is a piece that really needs to be followed up on and documented in some cases. Employee responsibilities, proper personal hygiene. We've heard so much about this recently, and we will touch on it more, but it's part of this cross-contamination piece. Executing proper cleaning and sanitizing methods are also of utmost importance. We know from our health inspection information that we gather throughout the year that cleaning and sanitizing of food contact surfaces and non-food contact surfaces are one and two of the top 3 violations across all health inspections. That's 2,800 jurisdictions across the states, United States. So that is an opportunity here, and we know that cross-contamination is also an opportunity to lead to foodborne illness. So knowing those 2 things, it's important to look at the responsibilities of the managers and employees and help reduce those numbers and help reduce the risk. Ruth also touched on cleaning and garbage disposals to avoid attracting pests that carry disease. They're also not something that we want in our restaurants. Zero tolerance is where we need to be, and they have, when they do enter our restaurants and when they are there, they're really unwanted guests and need to be taken care of, need to be, have a manager come in or a partner and help with that elimination. When we look at poor sanitation practices, again, explaining the correct procedures for cleaning and sanitizing is so important. Looking at how the chemical should actually be used. Doing all that work, you want to make sure that it's used properly. Should it sit in order to clean and sanitize, or even to disinfect? How long should it be on the surface? Again, explaining the relationship between properly designed, constructed, operated, and maintained equipment. Proven SOPs and a food safety management system are so important. You can have standard operating procedures in place, but if they're not working, they're not doing any help. They're not helping you at all. It's important to not only have those proven systems, but make sure you're flexible. Monitor corrective action, change your standard operating procedures. Certified food protection managers. We've seen that in a study, there were 821 U.S. restaurants. The FDA saw that there were higher numbers out of compliance with violations without a certified manager or a food safety management system at the location. Again, certified food safety managers as well as that food safety management system are important, and also following food safety practices associated with the control of Listeria monocytogenes in foods at restaurants. Responsibilities. Maintaining the cleanliness of the equipment is an employee responsibility, but again, that's also an area where the person in charge needs to monitor it. Follow the predetermined cleaning procedures, be flexible, change them, clean as you go. Turn up dim lights. We clean at night most of the time. Is it something that can be changed to the morning? Is it something that we need to turn on lights and use flashlights, pull out equipment? Sometimes it's better to take a flashlight, especially in areas such as an ice machine, while you're cleaning and then after cleaning is done to check the work. Work visual cues into cleaning and sanitizing responsibilities. Everyone learns differently, and we need to make sure that we're providing everyone the opportunity with the how and the why in order to do it correctly. And using the proper procedure, washing, rinsing, and sanitizing food contact equipment, all of those processes are needed to make sure that the areas are clean and safe to help reduce the risk of cross-contamination. Ruth also touched on the pests and the diseases that they can carry. So how do we prevent them? Large flies. Keeping the exterior clean is the start. If you don't have a dirty area in the garbage area or a back door, they won't necessarily be attracted to that area and be able to get in when we open the door. So it's very important to keep that area clean and monitored. Small flies, they are not acceptable. They can harbor and hard to get rid of. So it's important to clean drains weekly. You'll need to clean them more often if you actually have small flies. Cleaning and sanitizing the floors can get buildup and debris, as well as they can form larvae in those areas. It can be sticky where they want to stay. So it's important to clean and sanitize the floors as well, surfaces, drains, all of that. And if you're cleaning one area and you're not cleaning another, so if you're in the bar cleaning and you also have a service station that's not clean, they will easily move to that area. So it's important to have everything in that area clean. Rodents, eliminating, again, them coming in from the outside in, and cockroaches, reducing food and water sources, and reducing harborage sites, and working with your partner to help use insecticide applications are also a great best practice. Now, I think
Thank you, Mandy.
Personal hygiene. Yes.
Yep. Thank you. And let's move on to our third food safety concern that we want to speak to in this webinar, and that's personal hygiene. Why is it important? Well, some sobering facts here. Thinking about Staph aureus, it's estimated that 20% of us persistently carry Staph aureus in our noses. That's a reality of our biology, and we just have to accept it. It is possible that that contaminant from our noses can get into food if we don't wash our hands before we touch food. And if that food is contaminated, the bacteria can multiply and produce a heat-stable toxin that will make people sick. Now, we know that the bacteria themselves, the staph cells, are killed by cooking, but again, the toxin is not and will still be able to cause illness. So foods that are not cooked after handling, so think about ready-to-eat sliced meats, pastries, sandwiches, can be risky if they're contaminated with Staph aureus because the cells can grow and make this toxin. And if they are contaminated with the toxin, they're not going to smell bad or look spoiled. But we know that that action of the toxin in our gut can cause various gastrointestinal symptoms if we consume that toxin. Norovirus is another illness agent that we think about associated with personal hygiene. Those who are sick with norovirus typically shed more than 10 to the 8th viral particles per gram of fecal material. And it only takes a few to cause illness. So there's a tremendous dose that we can be shedding that can impact a lot of people. An infected person can be contagious for 2 weeks after they recover. And the shedding of particles may continue for as long as 2 months. So hence, a couple practices that we see within this is not working when we're ill, but also making sure we're washing our hands. Let's dig into norovirus a little bit more. I think we're all familiar, certainly, with what it can do from an illness perspective, but the reality is that norovirus is difficult to inactivate. It can persist in chlorinated drinking water and in the environment, surviving freezing, requiring very, very high temperatures to inactivate. It can survive in acidic environment. And studies have even shown, for example, it survives for quite a long time on carpet surfaces. We also know that it survives longer under cold, wet conditions, so those in a cooler, for example. We saw that the levels of virus titer or virus particles was reduced more than 4 logs at room temperature within about 7 days, but they only saw about a 3 log reduction at 45 degrees Fahrenheit after 70 days. And the graphic on the left demonstrates how norovirus can be transmitted most commonly. And we see that person-to-person transmission accounts for a great majority of these illnesses. That is actually from someone's hand to someone else. But it can be done through food or through water or through the environment, which would be like a hard surface. Another reason why personal hygiene is important is illustrated by this study related to salmonella, where it was found that transmission can occur by ill food handlers. And in fact, in those outbreaks in restaurants where there were positive environmental samples, that is, they were able to find salmonella on surfaces in the restaurant, they had a much higher proportion of salmonella-positive food workers than not. That is, people who were actively infected with salmonella. Sometimes we can have ongoing or prolonged outbreaks within one particular establishment, and it's possible and likely that there may be a very persistent reservoir of contamination, which may be these ill people. So, obvious takeaway is to keep ill food handlers out of the kitchen. But keep in mind that this shedding can go on for a long time, so there certainly can be challenges in managing that. Let's talk about a couple outbreaks that have happened. First of all, with norovirus. This occurred many, many years ago, but it's still a very, very good one to illustrate what happens. In this case, 126 people attended a dinner at a large hotel, and during the meal, someone got sick and vomited onto a wooden floor next to the table where they were sitting. Now, the staff reacted and cleaned the vomit with a mop and disinfectant, but the meal kept going. And within 48 hours, there were 52 other people who reported norovirus symptoms. And this graphic here illustrates this. The red triangle is where the vomiter was. We see that right above that table, there was a ceiling-mounted fan that allowed for some spread. And then as we look at the tables in close proximity to where this person was sitting, 91% of the people at that table got sick. And those on either side had attack rates of 56 and 71%. These green crosses illustrate where there were other fans in the room, indicating spread of that infectious material. So some lessons here. One is appropriately cleaning up a bodily fluid spill is absolutely essential to prevent the spread of contamination. And being aware of the realities of something like a norovirus incident and the fact that it can be airborne and transmitted by air. There's another situation with norovirus where an employee who had been sick with norovirus symptoms returned to work the very day that his symptoms ended. This same employee sliced lettuce and used that same sink where he was slicing the lettuce and washing the lettuce for hand washing. A total of 170 people became ill at 3 different events where the lettuce was used in sandwiches that were sent to these events. The restaurant had to be closed twice for cleaning in order to make sure that the contamination was removed. So a couple lessons that were learned from this is, one, staying home for at least 3 days, as is recommended by some health departments. Others may say 2 days, but regardless, staying home for a period of time, even after symptoms resolve, is very, very important. If we think about the biology of norovirus, we know that people, again, can continue to shed the norovirus particles long after their symptoms resolve. So coupling this with hand washing is very, very important. And then using enhanced disinfection procedures when there is a known outbreak are very important as well.
Thank you, Ruth. Echoing the importance of hand washing and personal hygiene, we refer to some health inspection information, again, that's been gathered across the United States. On health inspections from this 1 year that's shown, hand sinks were not accessible at a higher rate in the month of December, which we know is the peak of norovirus season. If hand sinks aren't accessible, no one can wash their hands. In a recent study, we found that 97% of people do not wash their hands properly. And if 97% of people do not wash their hands properly, and they can't have access to a hand sink, that just magnifies the opportunity and the increased for a foodborne illness. Now let's talk about some of the roles and responsibilities between the managers and the employees, as well as best practices. Manager responsibilities: model best practices, not everybody else's opportunity alone. Everybody needs to be included in poor and great personal hygiene practices and correcting those poor practices. Don't take for granted that everyone knows how to wash their hands properly. Walk through the entire steps and make sure everyone has the tools available to use the hand sink. Now more than ever, more people might be using the hand sink. Make sure we're checking them more often, that they're stocked with soap and paper towels and warm water. Make sure they're accessible. When it comes to ill employees, make sure that no one is working sick. It's very important that everyone follows this. If you have a situation where someone's working ill, as we just saw, and they're also touching or working with ready-to-eat foods and they have a slip-up, they're multitasking. They touch ready-to-eat foods or they touch lettuce, as seen in the last example. It magnifies, again, that increase for foodborne illness risk. So include employees from work if they have symptoms of vomiting, diarrhea, jaundice, which is yellowing of the skin, or fever. And restrict employees that have a sore throat with a fever or an infected wound that can't be covered with a bandage. Employee responsibilities are to inform the person in charge if they have any of those following symptoms or illnesses. It's a team effort. Managers monitor, but the employees also need to inform. Again, complying with the illness policy and not returning to work. Ruth mentioned the 72-hour symptom-free. It is a different requirement everywhere, but 72 is most certainly a best practice. Proper hand washing, proper care, cleanliness, and uniform standards also play a role in personal hygiene, and as we saw before, also cross-contamination. Thank you, Ruth. We'd like to go to the next slide.
Oops, sorry.
No, it's okay. I was patient for you. The health department partnerships. So when we talk through all three of the areas, temperature control, cross-contamination, as well as personal hygiene, your health departments and regulation are also experts in this area. They are there to partner. They are there to work with you, and they are there to coach and train. It's important to establish and maintain a working partnership with the local health department. Before any inspection, you should keep updated current contacts readily available. And we're seeing that now as we partner with health departments. If you have those contacts available, it's much easier and saves time to get a hold of someone. Involve as many managers and senior employees in walkthroughs and inspections as possible. It's not just one person's responsibility. Everyone in the restaurant has a responsibility to reduce the risk and protect your guests, the communities, your families, and themselves. So involve every manager and senior employee that can benefit from the walkthrough. During the inspection, ask health inspector or other jurisdiction visitors for proper ID before they come in. Ensure all comments are understood and clear. Asking those questions is okay. Make sure that you know what the risk is, why the risk is there, and maybe some solutions for how you can solve it. Correct violations immediately. If you have issues or a question that can't be corrected during the inspection, communicate that with the inspector. They are in all different food service facilities. They will also be able to talk you through best practices and work through that area. After the inspections, communicate. Meet with your managers and supervisors to talk about the deficiencies and also what went well. What are you doing well? What can you praise and recognize people for doing well as you come in and some of your systems are validated with what you're doing every day. Also, we do have a September Food Safety and Public Health Matters webinar, and that will be focused about health inspections and best practices. So a good time to learn about that information in September coming up. So to recap, we talked about the food safety essentials, and thank you, Ruth. She gave us that science and that why. behind every one of those food safety essentials. We know that properly executing on temperature control, prevention of contamination, personal hygiene, hand washing, sanitation, pest control, as we've seen examples from the past, these systems can reduce foodborne illness and making others sick. We need to learn from the past and learn from those examples so we can move forward, monitor, take corrective action, model best practices, coach, teach, train, change SOPs when needed, adjust systems, and develop and maintain a working partnership with your health department. Manager responsibilities are to understand the why the things are in place and how to prevent that disease. As we walk through and we finish that recap of the food safety essentials, we wanted to make sure that we also touched on general infection prevention guidelines with the COVID-19 situation. So we're going to walk you through some preventative measures that may help avert the COVID-19 as well as other illnesses. We have 3 areas of suggestions here and guidelines. Number 1, monitor the news and advice from public health agencies. We just touched on partnerships. Follow local public health recommendations related to this infection activity, where they are and where the risks are, and also to talk through any needs for isolation and closing. Implement good infection prevention practices, personal hygiene, reinforce it throughout the operation with everyone. It's a team effort. Provide hygiene materials such as tissues, hand soap, and sanitizer. Stock effective disinfectant products and follow protocols. Number 3, communicate and monitor employees. It's important, the why, the how, the when. Educate and inform employees. Closely monitor everyone's health and encourage symptomatic employees to stay home. We know those symptoms are fever and respiratory. Steps to help protect yourself, your employees, your guests, and the community. Public health recommendations focus on standard infection control practices, training, and compliance. Hand washing, staying home when you're ill, disinfecting properly. The good news is coronavirus is an enveloped virus. Enveloped viruses are the least resistant to disinfection, which means that disinfectants can be used to effectively kill coronaviruses on surfaces. When we look at procedures, we break them down here into risk profiles. We recommend that you take the following steps based on the risk profile within your operation. So this 3-tiered guidance is informed by public health reports and all of our understanding with the scientific characteristics of the underlying causes. We have green, yellow, and red. We would say right now that everyone is in this red area. Green would be our standard prevention. There's no known outbreak in your geographic area and you're following all of your current procedures. Yellow, risk reduction. The potential exists for an outbreak in your geographic area. We'd still build on those standard prevention procedures, but add on to that to increase employee education on the infection control, communicate this all to your entire restaurant, access your preparedness status, and collaborate with your partners on your response and readiness. That includes your vendors, your own company, and all of the guidelines that you follow within that and communication, as well as health departments and your partners in regulation. Make sure you increase the frequency of the standard procedures mentioned in green in the standard prevention. Risk, remediation. A public declared outbreak is in your facility or region and it's disrupting your normal business as well as your daily routines. We recommend that you enhance procedures to respond to the outbreak in your facility. following the chain of infection or illness, facilitate training or heighten procedures, reinforcing the personal hygiene, the ill employee policies, and the disinfections, but you would take that to the next level, making sure that you're following personal hygiene procedures more closely, monitoring people washing their hands more often, knowing that the sinks might not be as stocked all the time because people are continuously to wash their hands. So be aware of the situation and take action. Perform those heightened procedures using approved products. When we talk about disinfectants, make sure that your disinfectant has a claim for emerging viral pathogens to kill coronavirus. Use it appropriately. Make sure that you're looking at the label, letting it sit long enough to kill that emerging pathogen, and also using it on the right areas. High touch points are where you'd want to focus with the disinfectants. Doors, doorknobs, railings, areas where people are guest areas that people are really focusing in, and a lot of this will be needed with remediations and reopening of dining rooms and areas. So you'd also want to focus on the restrooms, other areas where people are, they're highly visible and using a lot. Planning for deep cleaning, as I just touched on, and reopening procedures after downtime or quarantine is of utmost importance. We also have many resources available at ecolab.com, and you are able to access those through our website for resources. So we are here to help. We are here to help you find solutions and to educate. So please leverage that. I'll also hand it over to Ruth. I believe she has more information on some of the resources that you have and how we can help.
Thank you, Mandy. I don't have a lot to add other than just if going to ecolab.com, there's a banner at the top of our webpage that will direct you to further resources. I hope we have time for at least one or two questions. I'll turn it over to my colleague Elizabeth, who will help to facilitate that.
Yes, thank you so much, Ruth and Mandy, for kind of walking us through the essentials. I think we have time for one, possibly two questions. So one that has come in is, can you please provide the definition and clarify the difference between cross-contact versus cross-contamination?
Yep, that's a really good one. Cross-contact is a newer term that has kind of come on the scene in the last several years, actually as a result of the Food Safety Modernization Act, or FSMA regulations. And cross-contact is meant to refer to contamination that results from an allergen contaminant. So, you know, a dairy substance, for example, that can be allergenic to sensitive individuals, being in a place where it's not supposed to be, so on a surface or in a food item where it's not supposed to be and can cause issues. That's cross-contact, relates to allergen. Cross-contamination has been relegated to more specifically relate to primarily biological kinds of contaminants, so bacteria, yeast, mold, viruses, etc. But there also can be physical contaminants, you know, bone shavings or whatever, things like that, that can also be under the cross-contamination umbrella. But because they're much rarer, we really think about microbes for cross-contamination and allergens for cross-contact.
Great. How about we do one quick one before we wrap, a second quick one before we wrap up. What are the best ways to verify sanitation and confirm that a surface is indeed sanitized?
Well, there's several different ways to verify. One, frankly, is just you're using our eyes, and is something visually clean. That is a way that such surfaces can be verified as being clean. From a sanitation perspective, we look to the action of a sanitizer to actually inactivate a microorganism. So if we specifically want to verify that, one way to do that is through testing for residual microorganisms through a swab test, for example. But there's other ways as well, and we should not rely solely on swabbing, because since we're relying on the use of a sanitizer to inactivate any microorganisms that might be there, making sure we're using that sanitizer at the right concentration and for the right amount of time. So monitoring these kinds of things and then having someone review the records to make sure that the right sanitizer was used for the right amount of time, or by observing someone who's doing the sanitation practices. Those are also very, very good ways to verify.
Great, thank you so much. If we did not get to your question, we will answer them offline and send them to you after the webinar is over. So thank you so much for joining us. And Connie, you can go ahead and put the final slides up. Thank you again for joining us on this webinar. Please stay on the line if you would like to, or stay on after the webinar to fill out the survey if you would like to get a CEU credit, and we will be sending those out next week. This webinar and the slides will be available on .com after March 30th for on-demand viewing, and also to forward to a friend if they were not able to join us today. Please join us. We do these webinars quarterly, so our next one is coming up June 4th, and we'll talk about your warewashing program. In September, we will talk about health inspections, and then we will have one in December as well. Thank you so much, and we look forward to for you to join us in June.